Welcome to Spectrum Psychological. My name is Alexander. I'm a psychologist by training, and today we're going to talk about motor vehicle accidents and the impact of an accident on a person when they're trying to drive again. So getting back in the vehicle and driving again can be a very difficult task for a person. They can be very scared, they can be very nervous. When they're inside the vehicle, they can feel really jittery, really trembly. Out on the road, often when the person's driving after a motor vehicle accident, they're driving with a great deal of trepidation, lots of anxiety, nervousness. Very frequently, they're driving quite slow, trying to be very cautious and very careful. That can often make them targets of other people on the road who bully them because they're perceived to be driving too slow. So that comes from this illusion that one has to be driving at the speed limit. But the speed limit is supposed to be the maximum speed limit, the upper limit. It's not supposed to be the recommended speed limit or the prescribed speed limit. That's the maximum that's posted up there. There's also a minimum. On a roadway, for example, that has a speed limit of 100 kilometers per hour, the minimum is 70 kilometers an hour, some places 60 kilometers per hour. So as long as a person's vehicle can travel between 70 kilometers per hour and 100 kilometers per hour, they are well within their rights to be on a roadway with a maximum speed limit of 100 kilometers per hour. But a lot of drivers, they expect people to be driving at minimum at the maximum. So there's an irony in that, and very frequently people are exceeding the maximum speed limit, and they'll bully other people on the road who are not traveling fast, at least at the speed limit, if not faster. So when a person's had a motor vehicle accident, they're very anxious and very nervous, and they're very scared. Very frequently, they're driving very cautiously, but they'll get bullied by other drivers on the road who are, either honking at them, or they're following them too close, or cutting them off, or giving them the finger. So they face this kind of abuse very frequently. It's very unfortunate. This kind of abuse, what it does is it heightens the driver's sentiments even further and makes them even more jittery, more anxious, more nervous, more stressed out being on the road. So you can just imagine when the person is driving in that heightened state and they're on the roadway and all of this is going on around them, they're holding the steering wheel in this high state of anxiety, and the vehicle is moving. Because they're so anxious and so nervous and so tense and stressed out, their likelihood of having another accident, in fact, goes up. Driving in this really heightened state, they can end up having an overreaction and end up causing an accident. So that's an issue that needs to be dealt with when a person is being treated for a psychological injury, when a person's being treated by a psychologist for all these symptoms that the person's experiencing after a motor vehicle accident. So the symptoms that I've described here so far are just the overt behavioral symptoms, but there are also physiological things that accompany these behavioral symptoms. When the person is anxious and nervous, accompanying that is a rise in their blood pressure. There'll be times when a person's heart rate just shoots up because somebody either braked too suddenly on the road or cut them off, and their heart is pounding and feels like your heart's right in your throat at times. So these are pieces that a psychologist has to work with when they're working with their client. They have to educate and teach and train them so how to deal with these moments when a person's had an accident and they're back driving again. The task of getting back behind the wheel after a motor vehicle accident is a very difficult one. It's a task of great courage, but as a psychologist, you have to be able to work with these pieces. So multiple pieces. There's this philosophical piece about driving and getting back behind the wheel again. And then there are other pieces, which are behavioral pieces, physiological. You have to teach the person how to calm and settle their body down. The emotional side, the mental, negative, fear-based, intrusive thinking, you have to be able to do that. All of this is the psychologist's work. So let's just talk about for a moment what kind of psychologist you would go to get help for motor vehicle accident related matters. So it wouldn't just be any psychologist. Different psychologists work in different fields. Some work in the area of relationships. Some work with the gender identity. Some work with children exclusively or ADHD, etc. In this case, you would be looking for a psychologist who has a very specific skill set, one who can work with chronic pain or pain management and that area. Plus, along with that, somebody who works with trauma, post-traumatic stress disorder, and also is familiar with something called prolonged exposure therapy desensitization. The reason being that very often the person is so highly traumatized by their accident that they have a great deal of difficulty getting back into the vehicle, and they need what is referred to as prolonged exposure therapy to help the client progress further, right? And that includes systematic desensitization, prolonged exposure to the vehicle. Sometimes it's to the area where the person had the accident, or things like that. Now, sometimes I get a file and in that there's a note, please provide cognitive behavioral therapy. I can tell you, CBT, cognitive behavioral therapy, is not enough when you're working with somebody who's had a motor vehicle accident. It's part of the picture, but the psychologist that works in the area of accident, injury, psychological injury, is not only utilizing cognitive behavioral therapy, they're utilizing several other modalities as well. For example, sensory motor therapy plays a very key role in the treatment of psychological injuries and working with chronic pain and so on. And then on top of that, they might use other modalities too, sometimes what is called EMDR, eye movement desensitization, reprocessing, that will come into the picture. Sometimes they're using hypnosis-based treatment, so pieces of that. At other times, they're using what is called ACT, acceptance and commitment therapy. So there are several pieces that are put together to treat somebody with an injury resulting from a motor vehicle accident. So I hope this has been helpful. If you have any comments or questions, please feel free to leave them for me and I will try my best to get back to you. In the meantime, good luck and take care.